Hello, my name is Paul Pruett. I'm the glaucoma specialist here at Baptist Eye Surgeons, and we appreciate you all tuning in for our Ask Me Anything session. So everybody submitted some questions, and so we'll kind of go through some of those. Let's see. Number one, how do I know if I have glaucoma? So unless your glaucoma is advanced, you most likely will not. The reason being is glaucoma early is a silent disease. There's no symptoms that I can tell people, hey, look out for this, and we'll check you for glaucoma if you have those symptoms. Glaucoma eventually does lead to vision loss and complete blindness. So if you're having some sort of vision problem, glaucoma could be the cause, but it's hard to say based just off of that symptom. Number two, what symptoms should I look for to see if I have glaucoma? And that kind of goes along the same lines. The symptom that glaucoma can cause early on is peripheral vision loss. So if you find that you're banging into door frames as you turn corners, or you while you're driving your car, maybe clipping things on the side that you looked over and you didn't realize something was there. Those are some symptoms that we hear from patients that let them know that something wasn't quite right with their eyes. Number three, if my mother had glaucoma, does that mean I will inherit it? No, not necessarily. So if you do have a family member that has glaucoma, your risk is higher than the average population, but it doesn't mean that you're going to develop glaucoma. But I frequently tell patients like that, especially like when a family member is in helping a patient come in, is like, have you had your eye exam? It's one of those things you want to make sure that you're at least getting checked at least annually if you have a family member with glaucoma, just to catch it on the early side. Because when it comes down to treating glaucoma, it's all about early detection. So can I do anything, or excuse me, I skipped a question. Number four, can my glaucoma be cured? So glaucoma is never cured, it is only controlled. Now for most people, we use eye drops to control the glaucoma. There are patients that we do perform surgery to lower the pressure, that's what the eye drops do, and that surgery can work for years. And so but I still follow those patients on a regular basis because we don't know how long the surgery will work. The surgeries can work for years, and I've had patients that have had surgery 20 years ago and haven't had to take a single eye drop, and so their glaucoma has been under good control, but they still technically have glaucoma. And the vision loss that's already occurred never comes back. The treatment only helps to prevent things from getting worse. Number five, can I do anything to prevent glaucoma? Glaucoma in and of itself is a lot of different diseases. So, but for most people, what we call the regular run-of-the-mill age-related glaucoma, nothing can do, there's no diet or exercise or anything like that that's going to prevent you from developing glaucoma. There are certain subtypes of glaucoma that are not as common, that if we do procedures or things early, we can prevent damage from happening. But again, key is just about early detection, getting an eye exam, getting things checked out to kind of address those sorts of issues. Number six, I just turned 40. At what age should I begin to regularly visit the ophthalmologist so they can look for glaucoma symptoms? So age 40, everybody should get a good old-fashioned comprehensive eye exam. That's generally when people start needing reading glasses or bifocals. So usually that's the thing that prompts them to come in. Personally, I'm 44, so I'm now in bifocals, and so those sorts of things hit all of us. But as part of that exam, to talk about reading glasses, we check for everything else, and so glaucoma is definitely one of those things. And if that exam is clear, then probably getting checked. Basically, every decade you want to shorten the interval. So during your 40s, after you get your initial eye exam, maybe 2 or 3 exams over the course of that decade, and then when you hit your 50s, every other year, and then when you hit your 60s, once a year is probably a good rule of thumb, just to make sure that we're not missing anything. Besides, there's glaucoma, but of course there's also things like cataracts and macular degeneration, which can be treated or things given to help keep things from get progressing over time. Number 7, I just found out I have glaucoma. Thankfully, we found it early. How will it affect my vision? What can I do for treatment, and do I have to get surgery? So, how will it affect your vision? So, if it's been caught early, which it sounds like in this case, you may not have any symptoms. I mean, I tell people the biggest inconvenience you may have from your glaucoma is coming and having to see me or whoever your eye doctor is on a 2 or 3 times a year to monitor to make sure that things are staying stable. So as long as the treatment's working and the pressure's staying nice and low, then you may not have any symptoms. So hopefully that's the case for you. What can you do for treatment? So, there's 3, the overall treatment is the same for everybody, and that's to lower the pressure inside the eyes. So we can do that a lot of different ways. Eye drops, laser surgery, and then surgery in the operating room. And so, but they all do the same thing, which is to lower the pressure. And everybody's circumstance is different. So as far as, in general, we start with eye drops because eye drops are safer. Anytime you do a procedure, that comes with a small element of risk. And we don't like to put people through risk unless we absolutely need to. So to answer your question, do I have to get surgery? Most likely not. Most people can be controlled with eye drops. The question is can you tolerate the eye drops? Are the eye drops effective? If those questions start to be no, then that's the time we start to think about surgery or other procedures. Number 8, my father has glaucoma surgery next week. What can I do to help him prepare and recover? So it depends on the type of glaucoma surgery. But worst case scenario, if it's one of the larger type, older glaucoma surgeries, the vision can be definitely blurrier than you're starting out with. Remember, the surgery only lowers the pressure in the eye. It doesn't bring any vision back. So temporarily, the vision may be worse than the vision was before surgery. But generally, the vision will come back to where it was beforehand. The other thing is the eye may be a little more scratchy and uncomfortable because there could be stitches in the eye. So just making sure, depending on if this is the better seeing eye or the worse seeing eye. If it's the better seeing eye, maybe having somebody around who can kind of help just help function with activities of daily living, so that those things aren't interrupted. But in general, people tolerate glaucoma surgery well. They also be limited in how much they can lift or strain. So if they need help with those sorts of things, we frequently tell people with manual labor jobs, you got to take some time off, let your eye recover. But don't pick up a heavy dog, those sorts of things. But outside of that, people can live their lives. Number 9, how do I test for glaucoma? So, when we see somebody just for a regular eye exam, we can, one of the things we do is we check everybody's eye pressure. 80% of patients that develop glaucoma have high pressures. We also look in the back of the eye at the optic nerve. Glaucoma causes a certain change in the optic nerve that we can look for. And if we see any of those sorts of things, we start doing further testing. And so the 2 big categories of testing that we do, number 1 is a visual field test. So like I said earlier, glaucoma causes you to lose peripheral vision first for most people. And so we can actually measure that peripheral vision and see if you have vision loss. It happens so gradually and so slowly that people don't notice it. And so it takes a formal test to actually spot check these little spots in your vision to see if there's something that you're not able to detect. The second test that we use frequently is something called an OCT, and that is a test that basically just takes a fancy picture of the back of your eyeball, measures it, and then we can compare it to the average person your age. And so it gives us these nice pretty graphs on whether or not you have a normal amount of tissue or do you have an area where your optic nerve is thinner than it is compared to the average person. And that is another sign that you might be developing glaucoma, and then we get started on treatment. Number 10, are there eye drops for glaucoma? If so, what do you recommend? So yes, there's tons of eye drops. So at this point now, we have approximately 6 or 7 different types of eye drops that work in different ways to lower the pressure inside the eyes. And we have some drops that are combined with other drops. And we have all kinds of options when it comes to medication nowadays for glaucoma. So what do we recommend? So generally we start with drops that are easy to take, that are relatively inexpensive, so usually a generic. And so, we have probably the most common drop we start with is a medicine called latanoprost. It's a drop that you take once in the evening in the eyes that are affected with glaucoma. And that works well for a big chunk of patients. But obviously we bring people back usually a month later after we start the drops to check the pressure, make sure it's working, as well as to make sure that people are tolerating the medicine. Are they having side effects, or for whatever reason does their insurance not cover it and they're having to pay $1 million for the drop? Then we try to find an alternative. So what I tell patients is my job is to keep you seeing, not to make you miserable. So we can do that sometimes with the eye drops, but we try to minimize that effect if that's the case. And let's see, I think that's the end of our questions here. So I just want to thank you all for joining us today. I hope I've answered all your questions about glaucoma. We'll be doing more sessions like this on different topics in the future. Keep us up to date on our Facebook page with things that you all would like to know about, as we'll be announcing our future sessions there. And I hope everybody has a wonderful day. Thanks for tuning in. Bye-bye.